Welcome back to PlacidWay Pulse, everyone. Today, we're diving into a topic that's honestly been exploding in popularity lately.
It really has.
Yeah, we're looking at why Seoul, South Korea, and specifically the Gangnam district, right?
Mhm.
Why it has become the undisputed global epicenter for plastic surgery and medical tourism.
Right. It's just incredible. I mean, you have people flying from all over the world, patients from the US, Europe, neighboring Asian countries. They're all bypassing their local, perfectly capable options.
Literally flying across the globe,
Exactly, just to get these premium enhancements in Seoul.
which is a massive commitment.
Yeah.
Getting on a long-haul flight for major life-altering surgery is, it's no small thing. So our mission for this deep dive is to uncover exactly why South Korea is the ultimate destination.
And we've got some amazing sources for this, including clinical journals and international medical tourism data.
Yeah, we really dug in. Because when you think about it, usually the epicenter of tech innovation is like Silicon Valley, right? But if you shift that lens to physically sculpting the human body, the Silicon Valley of aesthetic medicine is Gangnam.
That's a perfect analogy, actually. The sheer density of clinics there and the intense competition have driven innovation to a level that is, well, it's largely unmatched anywhere else.
Absolutely.
Yeah.
So whether you are actively researching your very first surgery abroad, or you're just fascinated by how a single city perfected this entire industry, this deep dive is going to completely change how you view cosmetic enhancements.
For sure. And I think to really grasp it, we need to look at the foundational differences in how these surgeries are approached, starting with the hyperspecialization.
Right, because it's not like the West.
No, not at all. In a lot of Western countries, a highly skilled plastic surgeon is sort of a generalist. They might do a breast augmentation on Monday, a tummy tuck on Tuesday, and then, a facelift on Wednesday.
Which requires a really broad understanding of the whole body. But the medical journals we reviewed show that in South Korea, the model is completely inverted.
Totally upside down. Surgeons there often spend over a decade mastering just one very specific, incredibly narrow technique.
Just one.
Yeah. A doctor might dedicate their entire career exclusively to complex facial bone contouring or solely to rhinoplasty. It's micro-specialized mastery.
That makes so much sense, though. If you're doing the exact same complex procedure day in and day out, your muscle memory and precision must be off the charts.
Exactly. They start to see these micro variations in bone structure that a generalist just wouldn't encounter frequently enough to even recognize.
And they're backing up that human skill with technology that, honestly, it sounds like it's from the future.
Oh, the technology is mind-blowing.
Like the bone contouring surgeries.
Yeah.
I noticed in the clinical data that they aren't just looking at a standard 2D X-ray and guessing where to cut.
No, they routinely use 3D CT scanners. They create a fully rotatable digital replica of your skull before you even step foot in the operating room.
Which is wild.
It's arguably the most critical safety advancement in modern aesthetic surgery. The surgeon uses specialized software to map out your highly intricate nerve pathways on that 3D model.
Like the inferior alveolar nerve, right? I was reading about that.
Yes, exactly.
Runs right through your lower jaw and gives sensation to your lip and chin. So if a surgeon strikes that nerve during, say, a jaw reduction,
You're looking at permanent numbness. It's a catastrophic outcome. You basically lose feeling in the lower half of your face.
wow. But with this 3D roadmap, they know exactly where it is.
Precisely. They can calculate the maximum safe margin for bone resection down to the millimeter. They know the absolute limit of what they can modify without ever compromising the nerve.
The mapping is brilliant. But the actual tools they use to make those cuts are even more fascinating to me. For the famous V-line surgery, they use these advanced piezoelectric instruments.
Right, the ultrasonic bone cutters.
Yeah. From what I understand, it works kind of like the cast saws they use in the ER.
Right.
Like it vibrates at a specific frequency to slice through the hard cast, but if it touches soft skin, it just harmlessly vibrates.
The underlying physics are very similar, yeah, just on microsurgical scale. Traditional bone cutting uses mechanical saws or drills, which violently tear through tissue.
That sounds brutal.
It causes a lot of trauma.
Mhm.
But piezoelectric tools use high-frequency ultrasonic waves. The cavitation effect cleanly slices through dense, calcified facial bone.
So wait, if the blade brushes up against delicate soft tissue or blood vessels,
It leaves them completely untouched. It selectively cuts only the hard stuff.
that is amazing. So it means way less internal trauma and like a massive reduction in postoperative bruising.
Undastically safer, yes.
Okay, but I have to push back here. If ultrasonic bone cutting tools and 3D nerve mapping are so overwhelmingly superior, why isn't every local clinic around the world doing this?
That's a great question, and it comes down to the barrier to entry, which is almost entirely financial. Plus, you need high volume experience.
Ah, so it's just too expensive.
Staggeringly expensive. The infrastructure to buy, maintain, and upgrade this tech is massive,
Hmm.
and the training to use these instruments flawlessly takes years. Gangnam has this unique ecosystem because the huge cultural demand and the volume of international medical tourists provide the capital to just keep reinvesting.
Right, they're operating at a scale that local clinics just can't match. But let's shift gears to the human element here. Because you can have all the fancy ultrasonic blades in the world, but flying to a foreign country for major surgery naturally brings up anxiety.
Of course it does.
You're put under anesthesia, thousands of miles from home. How do these clinics build absolute trust with international patients?
Well, trust is the currency of medical tourism. South Korea realized early on that a single high-profile safety failure could wreck their global reputation. So they implement aggressive safety protocols, like real-name surgery.
Oh, I was deeply unsettled reading about the catalyst for this.
Yeah.
It was a response to that unethical practice of using shadow doctors.
Right. Yes. It's terrifying. A patient consults with a famous surgeon, but once we're unconscious under anesthesia, an uncertified or junior doctor quietly steps in to perform the surgery.
Just a horrific bait and switch driven by profit. So the famous surgeon could double book their time.
Exactly. So to eradicate that, reputable clinics installed CCTV cameras directly in their operating rooms.
It's like a surgical dash cam. By recording the whole thing, they give you visual proof that the doctor you trusted is the one actually holding the scalpel the entire time.
That level of transparency is a massive confidence booster, and it extends to their emergency infrastructure too. Top-tier facilities must employ full-time, in-house anesthesiologists.
Which you'd think is standard, but in smaller clinics globally, there's sometimes just a contractor on call or bouncing between rooms.
Right. But in Seoul's elite clinics, a board-certified anesthesiologist is dedicated to your room, monitoring vitals continuously. They also have uninterrupted emergency power systems.
So if the city loses power, your surgery doesn't skip a beat.
Exactly. And beyond the facility, the surgeons themselves are tightly vetted. Our sources emphasize the importance of board certification through the Korean Society of Plastic and Reconstructive Surgeons, or KSPRS.
That's the gold standard over there, right?
Absolute gold standard. Getting KSPRS certified means surviving years of a grueling residency focused exclusively on complex craniofacial and aesthetic reconstructions. It separates the true masters from general practitioners.
Which brings us to the actual artist performing these surgeries. The sources highlighted a few standout clinics, and I was really fascinated by Arnwood Plastic Surgery.
Arnwood is incredibly unique.
Yeah, it's a premium boutique clinic led by Dr. Min-hee Ryu, who's a global authority on the deep plane facelift.
And his approach is a huge shift in anti-aging philosophy. Historically, facelifts were just pulling the surface skin tight, which gave that horrible artificially stretched, wind-blown look.
Right, nobody wants that. But the deep plane facelift bypasses the skin entirely. He works on the sub-SMAS layer.
Exactly. He meticulously dissects the retaining ligaments that hold that deep muscle layer to the cheekbones. By releasing those ligaments, he can reposition the entire underlying muscle and fat structure back to its youthful position.
So the surface skin doesn't bear any load at all. It just drapes naturally, which is why the results are so imperceptible. And he's so respected, he actually teaches advanced facial anatomy to other surgeons worldwide.
He does. But what's wildest about Arnwood is their capacity limit.
Oh, this blew my mind. They have a strict policy of performing only one surgery per day.
Just one.
It's like booking a Michelin-starred chef for a private dinner. You are guaranteed the surgeon's absolute, undivided attention.
It's perfect for someone wanting meticulous facial rejuvenation. But the sources also look at the opposite end of the spectrum, like VG plastic surgery.
Yeah, VG operates like an aesthetic powerhouse. They have a comprehensive, top-tier roster. You've got Dr. Im Young-min, the CEO, focusing on anti-aging and regenerative medicine, really healing at a cellular level.
And Dr. Hong Dae-won, their specialist for eye surgeries and rhinoplasty.
But the standout for me was Dr. Yang Jong-fil and his VG line philosophy. Because there's that negative stereotype of the cookie-cutter Korean plastic surgery look.
Right, the idea that everyone comes out with the exact same nose and jawline.
Exactly. So how does Dr. Yang combat that?
By prioritizing natural aesthetic harmony, he refuses to apply a standardized template. He meticulously analyzes the patient's unique underlying skeletal framework first.
So it's not about mimicking a celebrity. It's about finding the perfect mathematical balance, for that specific individual, enhancing who you already are.
And when you respect the original anatomy like that, the surgical intervention becomes virtually undetectable.
Okay, so we've established the tech, the safety, the master surgeons. But how does an international patient actually coordinate this? How do you manage the language barriers and logistics without losing your mind?
It's undeniably overwhelming to do it alone. Dealing with medical visas, translating surgical terminology, it's a recipe for massive stress.
Which brings us to Sarah's story from the case studies. She's a marketing manager from Los Angeles. Lost 110 pounds, which is amazing, but she was left with severe loose skin.
A very common, highly distressing outcome of rapid weight loss.
Yes, she was hiding her body. She looked into full body contouring in the U.S. and was quoted up to $35,000.
It priced her out completely. The cost in the U.S. and Western Europe has just become prohibitive.
So she looked at South Korea, but hit that logistical wall. That's where she used a medical tourism platform called PlacidWay. They act as a bridge, basically.
They're like highly specialized medical travel agents and patient advocates. They absorbed the entire logistical burden for her.
Right. They securely processed her medical history, matched her with ID Hospital in Seoul, and organized a virtual video consultation with the surgeon.
While she was just sitting in her living room in L.A.
Exactly. They gave her transparent quotes with no hidden fees and paired her with an English-speaking coordinator who physically accompanied her to the clinic.
And the financial disparity is the real kicker here. Premium procedures in South Korea are generally 30% to 50% cheaper than in the U.S. or Western Europe.
A standard facelift averages between $5,000 and $10,000 there. And on top of that, I couldn't believe this. International tourists can claim a 7% to 8% VAT refund at the airport before flying home.
It's true. You literally present your certificate at a kiosk and get cash back on your surgery.
The value is insane. But it's not just the upfront savings. It's what happens after the surgery, the aftercare.
The Korean model views rapid recovery as an integrated part of the package. They're famous for their complimentary deswelling programs.
Because in the U.S., you're sent home with an ice pack and some pain meds. But there, patients go back to the clinic daily for advanced therapies.
Like the SmartLux LED light therapy, which stimulates cellular regeneration, and radiofrequency massages to break up scar tissue.
All to flush out that stagnant lymphatic fluid that causes the swelling. And some clinics even use hyperbaric oxygen chambers.
Which is next level. Dissolving pure oxygen directly into your blood plasma to deeply penetrate swollen tissues, it essentially cuts the recovery time in half.
They've engineered every single touch point. It's a masterclass in medical hospitality. So for the listener who is researching their first surgery abroad, what is the core advice here?
Due diligence is your absolute responsibility. First, demand proof of board certification. Look for that KSPRS credential.
Right, no compromises there.
Exactly. Second, verify the safety infrastructure. Ask about CCTV, in-house anesthesiologists, and emergency power. And finally, utilize a vetted medical facilitator like PlacidWay to safely navigate the process.
Having a professional advocate lets you focus 100% of your energy on healing. Well, that brings us to the end of our deep dive. We covered so much, from ultrasonic bone cutting to hyperbaric chambers.
It really shows how intense specialization and technology can rewrite the standards of medicine.
It certainly does. But before we sign off, I want to leave you with one final thought to mull over. We compared Gangnam to Silicon Valley, treating the human body like an engineering project. With the integration of 3D bone mapping and techniques that leave virtually no scars, are we rapidly approaching an era where we no longer just age gracefully, but actively and safely design our own physical evolution? Almost like customizing an avatar.
Wow. It's a profound shift in how we view the physical self.
Definitely something to think about. Thanks for taking the plunge with us on this deep dive. We'll catch you on the next one.